All good?
Mm-hmm.
All right. Good afternoon. I'm Dr. Sandra Martell of the Winnebago County Health Department, and today I wanted to give you an update about the Chemtool fire and the release of the Public Health Impact Survey. So we've been going about two and a half weeks at this point through the Chemtool. We talked about the fire suppression phase, life safety phase, the environmental phase, and now we're really kind of in the health impact measuring phase. So with support by the Illinois Department of Public Health and the Centers for Disease Control and Prevention, the Agency for Toxic Substances and Disease Registry, I know that sounds more frightening than usual, but this is the group that studies it within the Centers for Disease Control and Prevention, we will be doing a health impact survey. The team has been working over the past 2 weeks to develop the plan, gather information from the public, figure out what kinds of questions should be asked based on what has been reported throughout the last couple of weeks. And the goal of the survey is to better understand the impact of the Chemtool fire on the health of individuals who are in the area. And that includes first responders, volunteers, if you were shopping, if you were a passerby in that area. So the survey is open to everyone who may have felt that they've been impacted. The questions were developed and vetted by the toxicologists, the epidemiologists, and the environmental health scientists based on previous chemical fires and what was on the Chemtool event. So when the individuals go on to the Chemtool survey, they're going to be asked some demographic questions. These are very familiar to everyone here, but for demographics, for things like name and birth date, address, locations that they were in. We're going to ask some very questions about where were you at the time of the event. What did you have contact with? Was it debris? Was it ash? Was it air? Was it water? Any symptoms you may be having, including both physical and mental health symptoms. If you sought health care services. And of course, there will be a question on pets and livestock because we learned from many of the calls coming in that people have pets and we do have livestock in that area. And so there will be a question related to that, which usually you don't see on a health impact survey. Our survey is going to be distributed through our Qualtrics platform, which was used for the COVID-19 response for the registration and vaccination effort. The link is pushed out on through the Winnebago County Health Department website on our front page and also the Chemtool page, which is www.wchd.org. In addition, we will be pushing out the survey to individuals in designated impacted zip codes in the Rockton area who had previously registered for COVID-19 vaccines. So we're going to do both an active push out to individuals who had registered for vaccine in the area based on their zip code and passive. So you can go on that website, you can take the survey, you can answer the questions. There are some important considerations about the survey. It is voluntary, but we are looking for a large response for those who are in the area at the time of the event. All responses on individuals will be kept confidential, but the data will be analyzed in what we call aggregate. We're going to combine all the responses so that we get a complete picture of what the impacts were to our community. If you are under the age of 18, consent from parent or legal guardian is required for you to complete the survey. And surveys can be completed. If you have a household of 4 with children, complete them for your children as well. Additional follow-up may be conducted with individuals based on their responses on the survey. So there's one of the last questions is, do you have pet or livestock? So there may be another survey or an interview may contact you to learn more about those pets and livestock and your experiences with them. The survey should take not more than 15 minutes to complete. You can use your tablet, your iPhone, or a computer. If you do not have access to technology, assistance can be provided through the Chemtool hotline, through the Winnebago County Health Department at 815-972-7300. Again, that number is 815-972-7300. I want to be clear with the public that this survey is not intended to be used as a medical screening tool. If you need health care, you need to contact your primary care provider or seek health care. The survey is intended to really understand the symptoms that you experienced. There should be no assumption that the survey is implying that their hazardous materials have been identified in the area. Again, our goal is to get a total picture of the impacts. After this week, next week, we will have members of the CDC and the Illinois Department of Public Health will have boots on the ground in our region as well. So we're pushing out this survey in advance, so we'll be able to start some data collection prior to their arrival, so we can get to the next phase of what are the next important questions for those follow-up surveys to be done. Some of those will be conducted in person. Some of them will be conducted again by another survey being sent to you. I also want to provide an update on the environmental health update because we know people continue to have questions about that. The Illinois Environmental Protection Agency is the lead agency in the response. Air, water, and land samples have been taken. The results continue to be posted on the Illinois EPA website because they are the owner of the detailed results. And that is open, available to the public through their website. At last review, the Rock River continues to remain closed to recreational boat traffic by the Illinois Department of Natural Resources to support response efforts. We still have people in the area, still cleaning, still removing debris and from that. So we want to make sure that all the responders are safe. Air quality samples have been fairly stable with reporting levels below federal regulatory standards. And I know every so often you'll see other people blogging about it. You'll get some, we talked about the inversion layer, you make it a little tick up and then it comes back down. The idea being if we saw a sustained level of elevation is when there is concern. Wastewater and runoff from the Rock River samples have been tested for what we call VOCs, or volatile organic compounds, SVOCs, which are semi-volatile organic compound, metals, biologic oxygen demand, and of course the PFAS and the PFOs. And again, the samples continue to show that they are within standards established by the Illinois Pollution Control Board. There has been some exception related to the Chemtool, what they call frac tank, which is actually on the Chemtool site itself, which is a little bit different than the surrounding area. So that is the one site that has consistently had some issues and concerns. But we have to be reminded that the Chemtool area and that factory site was a former Superfund cleanup site. So again, some of the environmental impacts persist there. At the Winnebago County Health Department, we continue to operate our hotline and our email for the residents to respond. It's at Rockton Chemfire at wchd.org, or the phone number that we gave earlier, and I'll give that again. And we are taking calls Monday through Friday from 8 to 5. It may take us some time to respond on some of the questions because we then go back to the agencies that are involved in that response to make sure that our responses are appropriate and have been vetted. So if it's a question regarding agriculture, we often have to go through the Department of Ag to make sure that we are providing vetted, accurate, and timely information to the public. Just a reminder, while we are taking calls, we will be closed Monday, July 5th in observance of the July 4th holiday. So in summary, the health impact provides an additional layer with the environmental health data, so the two will be analyzed together to better understand the impact of the Chemtool fire on our community and ensure that appropriate strategies and mitigations are being implemented to protect the whole health of the community. The response is ongoing and information is being shared as it becomes available. I want to remind the public both the US EPA is posting all of the air monitoring sample results on its website, and the Illinois Environmental Protection Agency is also posting their data on the site. And again, if you have any questions and do not have access to technology, please contact us at 815-972-7300. That is the Chemtool hotline number for us at the Winnebago County Health Department. You'll be speaking directly to health department staff, or email us at Rockton, R-O-C-K-T-O-N, Chem, we're going to put this all together, ROCKTONCHEMFIRE at WCHD.org. To date, we have handled over 150 inquiries from the community and provided guidance. And where possible and when it's appropriate, we've developed that information sheet that we have also shared with another community who is also being devastated by a fire on a lithium battery factory. So we are sharing our lessons learned, and we continue to work through this process. So with that, I'm happy to take any questions.
Dr. Martell, how vital is the information that you're going to receive through this survey to understanding the impact the fire had on the environment and on our community?
Well, I think that it's the health impact is going to be correlated with the environmental. To date, we've not seen significant fluctuations or concerns, what we would say elevations beyond. But I think it's also important to understand that even minor fluctuations may have a perception or impact people's health. And so correlating those two together. So our first thing was to get the fire suppressant out, which is what they did, begin the environmental sampling, and now is to survey really individuals and say, what were the impacts? What did you feel? Did you develop, symptoms? And then correlating those results together. That will become important for us to understand. And it really, the appeal is to put it together to the community, right? We learn every time we go through one of these terrific events in our communities, whether it's here in Rockton, Winnebago County, Illinois, or you're in Morris, Illinois, in Grundy County, or you're somewhere else in the United States. We inform each other by working through these, really all the thorough evaluations, both at testing and then the health impacts.
You said you had 100 inquiries that you responded to just today.
No, not today. I'm sorry,
Go ahead.
We've had over 150 inquiries to both the phone line and the email from the start of the event.
Is there any inclination how many of them are health-related concerns from community residents?
We log all the calls. We've not done that in level of analysis, but we began to, from day one, we did identify that people had some concerns about their health. And I want to also say the health of their animals and pets, and again, taking a look at that, we started to begin, we said from that point on, we really knew that we wanted to work to develop a survey to measure that impact in our community, and we requested assistance with support from the Illinois Department of Public Health and the CDC. This is an important step to really understanding and putting together the whole picture of the event and its impact on our region.
If people are experiencing symptoms, where do they go? What should they do? You said this survey is not to give them health advice.
Right.
Where should they go?
We have been consulting with physicians in our region. You should seek care from your usual source of health care. If you do not have a usual source of health care, we also have federally qualified health centers in our region that can assist you. They are also providing information and background in terms of people that are reporting. So again, we are looking at, this is the health impact survey that individuals complete. The hospitals and healthcare system partners have been asked to collect data of how many individuals are presenting with a particular complaint. So we're putting all of that together. But I don't want anyone sitting at home thinking this survey, if I put on there that I don't feel well, my eyes are runny, and I want some help with that this survey will generate someone following up to you to get a diagnosis done. It's important if you need health care that you seek health care, but this is to really kind of take a look at what were the variety of symptoms that people experienced post-event.
You said that the health systems are gathering data. Have you seen any of that yet? For how many people went there?
The question is, have we seen any results from the healthcare systems? No, we've asked them right now to make sure that they gather that data and collect that data, and if there's anything that they're seeing in a particular trend. At the beginning of this event, I talked about what we call the ESSENCE system, which is our syndromic surveillance, another, I know, large word, and we are all learning about this through COVID, is we look at emergency department visits to see if there are different spikes, but that's only if you went to an emergency department. That's why part of the survey is to understand, did you go to a primary care provider? Did you go to an urgent care? Did you self-treat? If you're, those kinds of things. You called your physician's office, maybe you did a telehealth visit and they instructed you to do something. That's the kind of information we're gathering as well. Because we understand, that's a very limited data set, and we wanted to really, I think it's really important for our community to know, we wanted them to be heard. We heard them calling us, having concerns, and we've said we need to measure the health impact. And it may be, again, correlation, we can't always imply causation, but we certainly want to know how this impacted the health in our Rockton area community.
Can you talk about, some of the challenges of, knowing all the different, I think people kind of want answers now, obviously, but, is there any sort of sense of when there could be maybe updated guidance for people to follow coming from this? Is that, there is the potential for that to happen, but obviously kind of the challenges of working with something and, maybe this is a longer term solution rather than something that's happening right now.
So that's kind of there is this short term, so we're trying to get people short term. Most of the short term has been how do I clean, what do I clean with, And I want to remind individuals that Clean Harbors is the hazmat waste management facility that has been contracted with both Chemtool, and it's also been a resource in our community. I mean, most of us know that we're not supposed to dump our cleaning supplies into the, into our wastewater, that we should be taking them to Clean Harbors there. So, what we talk about is, one, if you've got an immediate question, we try and get that response right away. But also when you talk about things like well water, it takes a while for a chemical to sleep down into the multiple layers, into the aquifers before that could be detected. That's why part of that is an ongoing piece, right? So we have an immediate effect, you can see smoke, you can move it, you see dust or debris on your yard, you take care of that. And so that becomes, we have this immediate, right? That's why we didn't survey you a day after the whole event. We had to take a look and see some of these things may take longer. We've been, I'm going to say, fortunate in our area. We had some rainwater in that first 5 days, and then we've had additional rain from that, which is kind of a natural cleanser in some regard. But we want to be on, I'm going to say on the threshold of monitoring, right? Part of this is, we talked about in public health surveillance, which is just that ongoing monitoring. This was a pretty terrific event, and we want to understand, does it have impacts, and where did it have impacts, and how did it impact us?
You talk a lot about how you're trying to inform another community, and I'm sure other communities have tried to inform you throughout this process. Did you guys have any outside sources come in? I mean, this isn't the first time a fire of this nature has happened. What kind of information did they come in and provide for you?
So the question is what outside resources? Well, one of the first reach outs is obviously I reached out to our Illinois Department of Public Health and said we're going to need support for understanding toxicology, right? I mean, that's the fancy word for substances that we're normally not exposed to. And at that point, they also went out and reached out to the CDC. So when you see the questions, and I know that's part of the little briefing packet, those were developed based on past experiences about what would you expect to see on a chemical fire of this nature, which is different than a forest fire, but there may be some similarities. And that becomes where you get the subject matter experts pulled together. And they are coming to provide us on-site support as well. We said we wanted to get this up sooner than they could put their boots on the ground, so we said we felt our community could manage doing some of these surveys online. They had demonstrated their capabilities and abilities through the COVID, and we said we can get this started so that what we can do is get a running start on this. So then we can do some deeper dives on some of those questions. Our area, which is unique, in that area, is that we have some agricultural land in addition to manufacturing in that region, as well as residential routine, So it kind of provides that nice, what I would say, kind of spectrum. And so some of that we have to look and see what have been the impacts from like volcanoes on farms and things. So all those scientists come together to really pull what are the questions that we should be asking.
How soon will the survey be available to the public?
The survey has been uploaded last night. Typically I do that, and there's a reason why, Chris, I do it before I always announce it, is that I can also I know people scope through the internet now and then, and we get a chance to test it out a little bit, see if there's kick the tires. We've, so you just, we send it out, we pilot it with our own staff, and then delete all the responses to see are all the yes, no's, and what ifs working the way that we want them to work. Does the translator work on this? Similar to what we did with COVID, if you use a foreign language browser, so if you use Spanish browser or you use an Arabic browser, the survey will display in your language. That assists us as well. So it is up now. We're making the official announcement. It's available to the public, and anyone can complete it. It does not matter your zip code or your state. Because we know we had people driving through the area that may have stopped in maybe to pick up a coffee or something as this was occurring. We have people that travel from other states to work in our regions. We have people that, were downwind and in different areas. So we understand we did not want to restrict who could really complete the survey.
When do you think you'll have results for the public?
Well, it's going to close on July 15th for the first round. And again, the idea being that for the 2 weeks. And so we'll have some preliminary, but again, when you say the results, it'll be more descriptive, how many people responded, What zip codes do they respond from? But, you know, when you're talking about the full analysis of compiling all that data together, that will be much longer.
You alluded to, you know, obviously the survey is voluntary, but you want more people to take it. Can you talk about, you know, how response rate can impact the conclusions you can potentially draw from something like this?
So the question is, you know, I'm putting the call out for as many people to complete it. Well, first of all, I think there's a reason for that. One, we know the zip codes and the plumes, and, you know, the scientists have given us all of that, you know, great information. And so we might be able to do some comparison. We know people may have been, you know, in another area. I mean, we're hearing about debris in areas that maybe weren't initially identified. So I think it becomes, you know, first of all, important for us to understand that maybe, you know, an area not necessarily identified in the plume may have been impacted, one, giving us some feedback on that, and then comparing those who were in the immediate versus those who weren't. Those were first responders and were in PPE, what we call, you know, or their fire turnout gear, versus volunteers. So understanding that as well, because remember we had volunteers report, we had, you know, when I look at the MABUS divisions, and again, a big shout out to all of, when I started to have to put the drop-down list of all the fire departments that responded, it is humbling to recognize the number of people that came out of their regions. And remember, some of our firemen and fire people are volunteers, came to help us in this response, but they're coming from different states. They may be coming from out of the region. People that normally don't come. So again, we wanted to know what their experience as well, for whatever time you were here and supporting us. All right. Thank you for your time and thank you for getting the word out. Have a great July 4th. Take a big breath.